Hello and welcome to this amazing initiative called KYC, Know Your Calling. Our speaker today is Dr. Dhairy, a neurosurgery resident who is here to guide us undergrads, interns, and MBBS PG aspirants through the process of choosing our choice of specialty and unlearning a few widely believed myths. Welcome, Dr. Dhairy, to your own initiative. Thank you for taking the time and effort out of your busy schedule for us. Um, let's start, sir.
Yeah, welcome everyone. So, just basic intro. I am from myself, Dr. Dhairy Boghani. I am from Gujarat. I studied my MBBS in a government medical college, Bhavnagar in Gujarat itself, and now I am studying in Kerala, Jubilee Mission Medical College and Research Institute, Thrissur. So, that's all about my basic introduction. We can proceed with the actual question parts.
Sir, our first question. So, what do you expect our mindset to be while choosing our branch of specialty? Because as undergrads, we have the least exposure to some branches.
So first thing about general mindset I will tell is you should not be biased. Biased in the sense we read medicine a lot in our undergrad. We read surgery and OG a lot. Even we read somewhat pedia. Then, but these are not the only branches. Okay, we read very less about psychiatry, derma, radio, ortho. Okay, even we don't work much except ortho. Ortho we work for a month in internship, so we may get some idea. But other branches we don't have much idea about them. Derma, even no one do internship in derma. Almost at no institute their compulsory derma internship. Then we have few departments which we don't work, like emergency medicine. Most of times emergency medicine department is not functional in their colleges. Then we have physical medicine, sports medicine, then family medicine, nuclear medicine, radiotherapy, then this rehabilitative medicine. So few departments we are not exposed at all. Few department we are exposed very less. So we should not be biased with that. We read very less about few things. So we should not be biased with them. We should know about actual life of the person who is living in that department. You should know what is being physician, what is being a surgeon, what is being pulmonologist, what is being psychiatrist. Okay, based on that feeling you should choose your branch, not because you loved working in some department, maybe due to seniors were helpful, that's why you loved working there. It does not mean you like that branch. Okay, so you should not get this bias affect your decision. You must think like you have to live with that branch for years, so choose whatever you love. Okay, there is no divorce. Whichever branch you will choose, you will live for a life. So that should be your mindset.
So, one major question that we get all the time: should we choose a medical branch versus a surgical branch or a diagnostic branch? What should we expect from medical branches? What should we expect from surgical branches? How do we expect life to go through in a diagnostic branch? How do we go about this topic, sir?
Okay, so actually, diagnostic branch are more of just like paraclinical branches. They are into very less contact with the patients. They are not handling much of the emergencies. So their responsibilities are very less. Responsibilities in the sense they don't have to wake up at 2 a.m. and run away to their own hospital. Okay, they can have peaceful night. They can have peaceful weekends. They can go on trips. Okay, they can enjoy their life in the sense their extracurricular activities and all these things. They can enjoy more than the physical, medical, and surgical branches. But the other they are protected from the violence against the patient and rage. All these things also they are protected. But in diagnostic branch, the same thing applies on the con side also, that you don't get much of the patient interaction. Like you talk to the patient. I'm not telling that you don't talk to the patient, but you are not the actual person who is making the decision for the patient. Okay, even as a radiologist, to diagnose something, but your physician or your surgeon may not be agreeing with the diagnosis, and he will take other decision. Okay, radiologist, pathologist, he will take based on his own mindset. So you are not actual decision maker. So you are not, you don't feel like you are treating the patient. That feeling will be less. That feeling will be absent almost. Then other part that is the main cone of these branches. So you don't feel adrenaline rush. So if you are someone who want peaceful life, diagnostic branches are best for you. Okay, radio, patho, micro, and even I will put derma to most extent to diagnostic branch. So it is a medical branch, but work is almost like that. Okay, derma work is almost peaceful. Like you can put your life into that category. Although branch is different. Then come to medical branches. In medical branches, you must be like detective, the type of personality. You see the patient, you take the history, you do the all the clinical examination, you do the which investigation to be applied, you do the investigations, then you diagnose something, then you choose best drug among the different drug groups. So it's like a detective work. You should see the micro things, you should think a lot, you decide based on that, your decision will matter a lot. Okay, so you have to coordinate with many different specialities, you have to coordinate many different aspect of patient's life. So that is all about medical branches. Okay, so it will be like medium level adrenaline rush because in medium level of work, because you are if you are a consultant, you can ask your juniors over the phone to give some medicines. Okay, sometimes you can skip being there on Sundays, sometimes you can take tour off. So these things you can do sometimes. Okay, means it is easier than surgical branches. In surgical branches, it is the most hectic and most adrenaline rush type of branch, because in surgery you have to be there. Rarely you will trust your juniors to do something. Okay, you have to be there. Even if they are doing something, you will have to be there. You will be monitoring, and you will be waking up at night far more frequently than any other branches. You will be standing for hours and hours into OT. Okay, but other part of it, that's why your personal life will be impaired. If you want to go out for 2 days, even for conference, you have to make sure other person is there to take care of your patients. On a Sundays, you have to come to ward, or you have to come, sometimes you have to come to OT. My consultant is like 60 years old, around 60 years old. He still comes to ward, and sometimes he do the OT on Sundays. He sometimes come at 2 a.m. Okay, I myself call him at 2 a.m. So these things is happening, what should I do? So there is no like, he also goes on tours, and he also enjoys a lot about is in his own way, but it is very difficult and it is very less in amount. So but the adrenaline rush is maximum, because once patient enters to your OT and when patient goes out of your OT, condition is far different. In medicine, you have to wait for longer duration of time. Except infectious disease, you have to wait for patient to improve. In surgery, it's like patient will come, you operate, and patient will improve a lot just after surgery. On other part, most patient will die also. Like maximum number of patients will die into surgical branches than any other branches. So that is also there, but satisfaction level will be high. If you are immediate result seeking type of person, you should go into surgical branches. If you have patience, and if you have mindset of like detective, you should go into medical branches. And if you want complete peaceful life, then you should look for the diagnostic branches. That is my general idea for how you should choose your branches.
Well summarized, sir. So, one very important thing that we come through, we have this idea of something called as a dream branch, and then there is a hierarchy of top branches versus lower branches.
Yeah,
So,
yeah, yeah.
how
Sometimes people have to compromise.
how do you decide that if suppose I get into a certain branch which is generally considered as a lower specialty, so do you take it, or do you take a gap year? Do you wait, or do you continue? How to decide when to do what, sir, in this case?
So in that, first thing I will tell you is you have one dream branch. If you are getting it, you should make sure that okay you are compatible for that branch. Just like our KYC, you are liking radiology or medicine or OG or anything. You just go to that video, you listen to those people, and you think, okay, yeah, this is the life I want. So decision is made. You go into that branch and you live happily. But sometimes what will happen is you don't get a rank to get into medicine. Then next what? Then you can think about your second choice, third choice branches where you can compromise if you have. If you don't have any other option, if you think that your life is limited to one branch, if you want like only just like for me, it was all about neurosurgery. If I can't imagine myself doing anything else in my life. So for me, either I can get neurosurgery or I don't get anything. So if you are that type of person, then definitely one or two drops is sufficient enough to take your branch. Otherwise, you can think differently. Then if you are more than two drops, then you can think differently. That is a different question. You have to compromise on something according to your financial and conditions. But then you can take drop if you are a certain type of person that you want this branch only. Then if you like 2 3 4 branches, so in that case you should explore the other branches you like and you should try for that. Okay, if you like those branches you will be happy in that, because if you are not certain, then it's just like what I will say is uh, you you don't have 100% of idea that you like this branch only. So other branches you like, you live with it, and gradually, like the arranged marriage mein love hota hai gradually, like that type of feeling. You will love your branch gradually. But the other type of thing is some people think that pharmac or patho, or they are very much far inferior branches. They should not take these non-clinical branches. They should not take it. People will laugh at them. They will not be successful in their life. For that, I want to make some comments. That if you are good, if you love the branch, if you are good at, you can earn any amount of money, fame, and you can earn any amount of happiness in your branch. Okay. Just like if you see the example of a few great pharma teachers of in our India, like this Govindrai Garg sir, everyone knows him. Okay, he is very much happy. He is earning a lot. He is famous. He is a pharmacologist, but he loved his branch, and that's why he made his own way through it. Same, like I can take example of all the branches, all the teachers, or other specialists. Like I met one pathology specialist who was flow cytometry specialist and working in Mumbai in very Tata Memorial or something like that, only very big hospital. He was very happy with his life. He took pathology because he was not getting anything else. But after that, he thought that okay, I should love pathology. He was liking pathology. It was not like he was not liking it all and he went into it. Then you should not go into it. But he was like, yeah, I can adjust with pathology. He adjusted with pathology, and then before the age of 30, he became one of the most topmost pathologists in his field, topmost flow cytometrist in his field, and he is earning a lot. He is very very happy in his own branch. Okay, so it's not like branches are inferior. All the branches are top. If you love it, if you work into it, you will excel. That is the basic principle. But you should like it. If you don't like, don't take. Just because you are getting, don't take it. Please don't take it. Okay.
So there is something called workload assessment. We are undergrads. How do we go about? Because we cannot go to every single college and we cannot find out how it works there. So how do we know the workload assessment of each different residencies? And what is your opinion on each?
Okay, workload. For workload, I will say one thing is if you are a resident, you will have enormous amount of workload. With any branch, more hectic branch will have more workload. Less hectic branch will have less workload. Like if you compare the surgery resident versus pharma resident, surgery resident will have definitely have more workload than pharma resident. That is true. But even pharma resident won't be sitting at home all day. Okay. Surgery resident will be working 24 into 7. Same medicine or pulmonology resident will be working 24 into 7. There is no much differentiation into residency life. But later, it's different. So workload is something I want you to decide based on people, what people are working after. Workload you can manage after 10 years, not now. In residency, 3 years will be hectic. 1 year or 2 year of SRC fellowship, this 2 3 years of struggle will be hectic. Then you start your own setup and all. This will be hectic. This almost 5 to 10 years will be hectic. So don't worry about that. You just look at people who are 35 plus, what they are doing. Okay, it is not even branch specific. Like I have seen one of my UG college professor, surgery professor. He had a hobby of singing, and he started singing at a big stage at age of 40. He started his career in singing at that age. He is a very good surgeon, but he is in government college, so he get 2 duty days. He has all the workforce. He has junior residents. He has SRs. He has APs. Everyone works under him. So he get into OT only when required. He don't he can manage his workload because of all those people behind him. If he had done his private practice alone, then he may not be able to put on that for workforce behind him, and he may not able to manage this workload. So even being a surgeon, but if being a physician, you will get more chances. Being a pathologist and radiologist, you will get far more chances to enhance on your hobbies. So it's not like absolute thing, but more hectic branches means more in surgical and even in surgical neurosurgery or cardiothoracic surgery. These are extreme hectic branches. Chances of doing your own work will be less. So workload you should think about 10 years later workload. In medicine, you join some UG college and you are a faculty there. You will have very less amount of workload, compulsory workload. Whatever you love, you spend time into wards and procedures and everything. You do it, OP and all, but you will not have compulsory workload. So that is the thing. Don't look at residency or just post residency life. That will be hectic in all the clinical branches. So don't worry about it. Even radiology will be hectic.
So there is this whole concept of saturation. Everybody says pediatrics is saturated. Everybody says general surgery
Yeah,
is
yeah. Everybody
saturated.
will say their own branch is saturated. That is a norm in India now. But this is just a biggest myth you will ever listen. Because like some few days ago only, Raja Mahendran sir has written one post, and he has told that the doctor is the last person who will die out of hunger. Any branch you take, okay, we will never gonna be unemployed. We will never gonna go to everyone say with degree certificate, please give me a job, please give me a job. We will always have a job, good job, which will which will lead us to good amount of money and satisfactory life. You may not earn into lakhs and crores, just like your seniors you are seeing, like 60 years old, 50 years old, this consultants who have practiced with between 20, 30 years. You may not earn to that extent. Okay, it will depend on your own skills and other parameters, luck parameters, where you settle. So many factors are there. I don't want to discuss about those factors, but it will depend. But I want to say there will be enough amount of work for you, whether you go to any branch, starting from anatomy to surgery. Okay, otherwise everyone will say every branch is saturated, but no branch can be saturated. There is always void in all the branches. Okay, so this concept
So
of
there is
saturation is very much, very much exaggerated by the people who don't like their own branches. That's why they say it is saturated. They are not loving enough into their branches. They don't want to grow enough. That's why they are saying they are not getting job, because they are not getting good jobs because branch is saturated. It is not actually branch saturation. It is your own mindset saturation, which is not allowing you to grow more. Okay, if just for example, I will tell you, if there are if, like in Ahmedabad city, if there are 50 neurosurgeons, Ahmedabad city is saturated with neurosurgeons. Okay, but there are very few functional neurosurgeons, very few good onco neurosurgeons. So if I am best at onco neurosurgery and functional neurosurgery, I will work at my own pace. Okay, someone endovascular neurosurgeon will come, pediatric neurosurgeon will come. He will work at your own pace. He's someone best in glioma, someone will be best in meningioma. He will be best in, like, he can work. He need not to care about 50 other neurosurgeons because he is best at what he is doing. So saturation is there, not there in any of the branches. Don't worry about saturation. Whoever tells you this is just a myth, so please don't fall into that trap. If you love the branch, go into that branch. Don't worry about saturation.
Sir, another concept, settlement, financial independence and financial settlement. Some say some branches have take longer. Some say
Yeah.
some branches
Yeah.
take shorter time.
So it is something like, that uh, I can't see I can't show the picture now, but if you just imagine, there will be, like, one graph is like that. It will be steady growing. This is for most of the medical branches. You start earning 1 lakh, then 2 lakh, 3 lakh, 4 lakh, 5 lakh, 10 lakh. Okay, like that you will be steadily growing. Then there will be coming this diagnostic branches, starting with 3 lakh, ending at 7 lakh, 6 to 7 lakh. Then there will be surgical branches, starting at 40,000, 50,000, will be reaching at 2 lakh, just like, this flat curve in starting, just reaching after 5 years only 1.5 lakh, 2 lakh, not more than that. Then suddenly rising, 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 rising like a steep curve. Ultimately, everyone will be at same level. So the settlement basically in surgical branches, because of the learning curve is very, very high. So in starting they are very less. They feel like they are less settled. They are just in learning curve. So they require almost 10 years to 15 years to settle. Medical branches, they settle into 5 to 6 years. Almost all the people settle into 5 to 6 years, 7 years. And diagnostic branches, 3 to 4 years, most of them will settle just after coming out of the PG or after 1 year of SSC fellowship. Most of them will be settled. Not much of work will be required. Okay. So that is the basic concept of settlement. Otherwise, again, it is an individual base. If you are best at what you are doing, if you are focused into something, you will do best in your branch. You will settle early. You will settle at a high level. That will depend only on you, no one else. Not on a branch, not on your city, not on your all conditions. It depend only on you. Okay.
So there are some branches such as pulmonology or orthopedics, maybe not orthopedics, maybe neurosurgery. So these branches are considered end branches, and somehow they see people tend to choose them more because they believe that there is no more further learning curve after that. So what is your opinion on that, and what is the reality behind this?
Yeah. So that's what I was just talking about: pediatric neurosurgery, endovascular neurosurgery, onco neurosurgery, functional neurosurgery. Okay, there is not the end. Okay, there is even, like, after doing onco neurosurgery, I have seen one consultant who has specialized into glioma, and he has spent all of his life on the glioma. Still, he was never bored working on the glioma. Every other case is different. So there is no such concept of, end branches. You say surgery, then neurosurgery, then onco neurosurgery, then going into glioma. It will be a long, long, long pathway. Okay. So it is not like you can ever get any branch, and it is not like you cannot get any branch. People, I have seen in my town itself, there is one medicine consultant who is doing completely amazing. He just settled before 2 or 3 years. When everyone was doing speciality, he chose to end at the general medicine. He chose a small town with 70,000 of population. He settled there. He has a good hospital with only 4 bed, 4 indoor patient, and just small room with his clinic and ECG and everything. Just basic setup he is having in the town, and he is doing completely amazing. Okay, still you can also do that thing. So even the, like, most known non-ending, like this non-ending branch medicine. You can settle with general medicine, and you cannot settle with even most end branch. You can say like onco neurosurgery. So it is all individual based. What you want to work upon, what type of work you want in your life, that will decide what will go on. So there is that's it.
Sir, sir, there is one more concept that I wanted to talk about. Sir, people say that once you super specialize in something, you are limiting yourself. Is this true for any medical branch or surgical branch where it's just because you're super specializing, you're limiting yourself to one corner and you are
No,
completely cut off from the
no,
rest of the world?
I don't agree to this sentence at all. Okay. I don't agree to this sentence at all, because there is, you can never limit yourself. You can never limit your knowledge, because you know that as I told someone as specialized to glioma, that glioma can be of so many different types. Every case of glioma I see has a different challenges. So even someone specialized just into glioma, he will never see two ideal cases, okay, two similar cases in his whole life. So you are no never uh, you are never settling with something like you are going into, but you know each and everything about that branch. You can't know each and everything about that branch. Even for glioma, the person who is specialized into glioma cannot know 100% of glioma. So it's always he can work upon new things. He had around 300 papers. If he knew everything about glioma, why would he do 300 research projects? So it's just like you are focusing on some area, you are being best at it day by day, and you are learning more and more about that particular topic, because you cannot learn about everything in a best manner. That's why it is like specialization, but it is always individual choice. If you want to be general medicine, you'll be treating few common 100 common diseases mostly. Apart from that, you will mostly refer to specialist. Then those specialists will be treating this 30-40 cases of those specialty. Then out of those 30-40 cases of those specialty, there will be super subspecialist who will be treating just 5 cases of their specialty. But that 5 cases in that 5 type of diseases, there will be spectrum of patients. Maybe he won't have spectrum of disease, he will have spectrum of patients who are completely different to each other, bringing a new challenge every day, every time. So it's like that.
So since we are talking about surgical branches, so what is the importance of having hands-on experiences, getting cutting chances once you graduate?
Yeah, whenever I have heard this thing 1,000 times. Whenever someone people will say, then you are going into general surgery, you just check what amount of cutting chances hands-on you are getting into that particular institute, then only go there. But I will just say one sentence. भाई काटना तो पूरी life है. You are going to cut for a life, whole of your life. Next 30 to 40 years, 50 years, you are going to spend into theater, operation theater. Why are you focusing on for next 3 years only on that basis? What is the hurry? Anyway, in surgical branches to be best, you will require a few years. Anyway, you will require say, 10 years, almost 10 years you will require. Then why are you focusing on just 3 years? Okay, just about cutting chances. There is more, like one of my great consultant told me that if you know how to cut, you are a good surgeon. If you know when to cut, you are a better surgeon. But if you know when not to cut, you are the best surgeon. So for being a best surgeon, you should know what are the how to prevent the complication, when not to operate, when OT is required. You should be able to balance between speed and accuracy. There are so many factors associated with that. You can achieve speed with accuracy. You have to learn hundreds of new techniques. With modification of your technique, you can learn new skills. That all will require time. If you just hurry into cutting, if you just get chances of like if you just worry about chances of cutting, you will just you will fall into, I'll say, you will fall into desert, which is not going to end anywhere. Because in whichever branch you go, if you have good sound theoretical knowledge, technical knowledge, just knowledge, then 6 months or 1 year of practice will be enough to excel for you in any branch, any of the surgical branch. You do 5 or 10 cases of one thing and you are specialized, you are a master of it. You don't need 100 or 1,000 cases. If you do the perfect 10 cases with perfect technique, you will be mastering it. I have done, just I will give just my one example. I have done I have closed the that fascia closer 10 to 20 times before, 10 to 12 times before. But just few days ago, when I was posted under some consultant, he told me that I will observe you today and you do it. And when I was doing, every time it will be something like I had to remove a suture again and I will reinsert it again, and this type of things will were happening 10 to 12 times. Every time it would happen, something will happen. But that consultant told me that I will observe you today and do it under my observation now. I started doing it. He told me that you are doing this thing wrong. He pointed this out, and I improvise on that thing. After that, I have just done two suturings, two facial closure. Both of them were far more perfect. Just he told me one technique, and he just show me for one suturing. He observed me for one more suture. That's it. So if I continued doing that type of suturing before like 100 times, same applies to any of the procedure, any OT. You do the wrong thing for 100 times, and you do just 2 or 3 times with perfect technique. 2 or 3 times will be far better than 100 times wrong things. So that's why I'm telling, don't worry about cutting chances and hands-on. You are theoretically, technically good, and you don't get anything. If you don't get anything, then also you can go for SRC into government institute and in a big volume institutes, and you can get your cutting chances there in SRC. You have the sound theoretical technical knowledge. You just go there and practice it there. Your work is done. You will come out as a best surgeon. No doubt about it. Many people have done it, and all surgeons who are experienced will agree with me in that parameter.
So let's come to the more pressing question for undergrads. DNB versus MD.
Yeah, so this is one of the evergreen question. So I will say, for few branches where you don't require much of the patient exposure and extreme amount of patient exposure, rather you require more of the technology, just like radiology, nuclear medicine, radiotherapy. In these branches, DNB are far higher, because they will have each and every instrument. Apart from AIMS and PGI, JIPMER and all the central institute and all the very big institute, no institute will afford even MRI. But if you go into private sector, all the DNB institute will have MRI. Government setup, no institute will MRI. So this is the difference. But when you go into medical branches, then it can be both can be similar. Like there are two school of thoughts, and I think both are right. You learn, you practice few things many number of times, then you go into then you go into private setup and you fine tune those skills according to protocols and all. That is also good. Means doing your MD into government setup and doing your fellowship or SRship into private institute, or you do the something into private institute, like you work according to protocols, you learn the protocols, and then you come out and for practice you go into government institute and do high amount of practice. So for MDMS and all other branches, both are almost similar. But if you are getting institute MDMS or anything which is having high patient load, also high patient load and high amount of exposure also, plus they are following protocols, if you are getting that type of institute, they are best. No doubt about it. You can choose them over DNB anytime. no doubt about that. But if you are getting, like, just for getting the seat of MD, you are going into far more peripheral government college where there is no exposure and no protocols are followed. You are just doing work like work like nurses and class 4 people. Then DNB is far better, which are giving you opportunities to learn. At least learn. If you can't practice, you can learn there, then come out and you can practice more into other setup. So just for the sake of degree, MD or MS, don't fall into that trap. If you are not getting MD and MS, doing DNB will not harm you at all, because even in outside India, in UK or any other country, their rate DNB is a far higher than MDMS, because MDMS has no not that uh, objective exam system. DNB is an objective exam system. Means if you have passed DNB, you have enough knowledge. That proves that you have enough knowledge. You have passed MDMS, you may have just you may have just talked with consultant nicely and bought some cigarettes for your consultant or alcohol for your consultant, and you may pass. There is no guarantee you have enough amount of knowledge in MDMS. There is blunt truth. We'll put it on the YouTube. I don't have any issue. That is a blunt truth. Okay. So that's why you
So,
can choose DNB confidently. There is no harm in it. And about differentiation, only your peers will differentiate. Patient won't see your degree. Patient will show your knowledge, your result. Patient will only care about you can cure them or you can't cure them. That is the only thing patient will see in you. Your and if patient will see this, patient will come to you. So only corporate will also see only that thing, how much patient you can bring, and you can bring patient on your own knowledge and skills, not on your degree. Okay, AIMS gold medalist can have 10 patient, and diploma in some branch, from diploma DNB in some branch can have 25% at the same time, same center, same things. Okay, there is no guarantee that your college or your degree will prove as your backbone. You have to have your knowledge and skill that will prove, that will be your main thing. So don't worry about degree. If you are not getting MDMS, you can always choose DNB without any doubt or any fear.
so the 3 years versus 6 years question, sir.
Yeah. So there are 4 courses in 6 years: cardiothoracic surgery, neurosurgery, cardiothoracic vascular surgery, neurosurgery, plastic surgery, and pediatric surgery. And other branches are like Nimmans provides DM neurology course, and AIMS provide DM infectious disease course. Other than that, there are or some, I think AIMS provide trauma, MCA trauma also. I think so. So these are the branches you get for 6 years. So when to enter into 6 years course? When you are 100% sure that you want that branch only, then only you should go for 6 years course. If you have any amount of doubt, you should not go for 6 years course. At any cost, however, you should not go for 6 years course. If you have doubts between 2 6-year courses, then you should never go for 6-year course. If you think I can either take plastic surgery or pediatric surgery, you should never go for it. You should always go for general surgery. Because just a simple example I will give you. If you like Meena, if you love Meena, and you are sure you want to spend your life with Meena, you marry Meena. If you love Reena and you want to spend your whole life with Reena, you marry Reena. Okay, but if you are not sure, you are liking Meena and Reena both, then what you should do? You should date both of them. Then you can decide which one you like more. So general surgery, general medicine. If you are sure that you want to do super specialization, it's just like dating game. Okay, you date all the super specialty branches coming in your way, and then you decide which best, which is like which is your soulmate. So then you go into that branch. But when you are sure you are love into that branch for years and years, and you know that you can't imagine yourself doing anything else, then you can absolutely go for it, because learning curves are very high in these branches. So if you go earlier, it will give you few years of advantage. It is not significant, but still, like, you will feel like you are not wasting years in doing other things. Like, I am as a neurosurgeon, if I am keep on doing hernia, appendix, and diabetic foot, or left coli, then I will be feeling what I am doing. I want to operate on the brain. Then I will spend 3-4 years into general surgery, my PG, SRC, and this NEET SS exam. So I will be feeling like, okay, why I am spending these years on into it? After being a neurosurgeon, I am never going to operate on appendix or hernia. So that's why it's better to go into neurosurgery directly. But if you are not sure, you like 2-3 branches, then always go for 3 years course, date everyone, and then decide. Other thing is, don't take 6-year branch because of the fear of exam again, because competition will be very very less. One thing. Second thing, if you have gone through the exam this time, if you have scored the rank this time, you can score again also. So don't worry about your exam, NEET SS exam. NEET SS exam will be competitive, but it doesn't matter much. Don't fall into trap that you don't want to give other exam. That's why you are choosing a branch. Please don't do it. You will feel entrapped into that branch for 6 years, and whole of your life you will regret the decision. I will give. I'm saying 100% you will regret your decision if you are choosing just based on you are getting it, and you don't want to give another exam. That's why you are choosing it. You will 100% regret it. Please, please, please don't choose it. If you are 100% sure, if you are in love with that brand, then only choose it. Okay.
Sir, since we're discussing DNB, sir, it is a very common knowledge that there is very low pass rate in DNB.
Yeah.
Sir, how does that myth stand?
Okay. I agree that there is very low pass rate in DNB, but I want to point out few things. One is that DNB is objective exam. So this pass rate is not based on luck. It's based on your preparation. Okay. If 30%, 40% are passing, it may be luck, like 2020 paper was easy, 2021 paper was hard. But everyone was asked same question. So if your peer is passing and you are not passing, then fault is yours. 100% fault is yours. There is no one else controlling it. So if no one is controlling it, then you can work very, very hard and you can pass. That is the first point. Second point, even if you fail, then anyway in this times, like when everyone is going for fellowship, SRC, no one is independently working just after 3 years. If you fail for 1 year, for 6 months, 6 months, every 6 months DMD take exams. So even if you fail for 6 months, you will come out after 3.5 years. So anyway, you are going to do SRCP at other institute, or same institute. Even some people do same SRCP in same institute. So you do 6 months extra, you pass 6 months extra, you learn extra, something extra. You'll be fourth year resident over the third year resident. You'll be more senior. So you can do the all fruitful things. If you are a surgeon, you can get more cutting chances. You can expand your surgical skills better in those 6 months. Why are you worried much? Anyway, you are going to get degree. No one is going to ask you how many years you took. You better than taking a drop for 1 year. There are some, like, if you have 60% passing rate, there are 40% chances you may fail. Okay, in that 40% chances also, you may pass after 6 months. So you may save 6 months ultimately, better than taking 1 year drop. Okay, so why to take drop just for this reason? Just take it and work hard.
Sir,
Pass.
sir, there are some institutions in our country which are considered as absolutely esteemed institutions, prestigious institutions, AIMS, JIPMER, and all that. Anything apart from that, they are people tend to look down upon it. So, what is the importance of the college that you take up in your career?
Okay, I will better than answering just for aims or JIPMER, I will give general narrative about what is the importance of college in your life. So college is something will you are 3 years, you are there for 3 years, or if you choose 6 year course, you are there for 6 years. So for those 3 years, you are signing under the consultant. Like, my consultant is XYZ, so I will not sign on myself. I will sign by Dr. Dhairy Boghani for Dr. XYZ. Okay, so I am not responsible for whatever I am doing. So if I am studying into good institute, if I have good mentors, they will mentor me in such a way that I will be better in that subject. It is all about importance of good institute. But in case if you can't get very good institute, if you are going to average institute, same thing will happen. You will not that you will not be discouraged of doing things. There are very few institutes which discourage you from doing things. Those institutes you should try to avoid. But most of institutes are like they don't care about you. Very few top institute will mentor you. Very few institutes which will discourage you. In between, almost all the institutes are like professors won't care about you, what you are doing. You read, you excel, or you fail, and you go into depression. No one will take care of you. That is the reality in most of the institutes. So in that way, if you are not getting very good institute, work hard, make yourself better. Okay, work on yourself and create chances for yourself. I will tell just a basic example of myself. In my institute, my UG institute, I was not provided any much great amount of research opportunities. In my institute, like all the maximum number of research project anyone has done was two from my seniors and anyone. In my class, only 2 to 3 people every year, 2 to 3 or four project were maximum number of projects done by UG people. 3 to 4 people. Okay, I have done 7 to 8 per year. I have done 25 more than 25 of the research projects. I created this opportunity for myself. Double than others, total number of people for like all 5 batches are doing. I was doing double than that alone. No one was like, there are few teachers will be there, you will find out them, but most of the teachers were not caring about it, and few were even antagonistic. But I created my opportunities. Somehow I managed. Few teachers like Dr. Tripathi was my guru, and he helped me a lot. So there will be some professor you will find out. Although Dr. Tripathi sir was a pharmacology consultant, I never did any project in pharmacology. He helped me in my emotional and in my like how to stay there, how to do the work. Okay, so it's like it's not important that you are not getting opportunities or you will left behind. You can create your own opportunities. If you are growing up into environment where you are encouraged a lot to do something, then it's always better. But if you can't get, that does not mean you are failing. Okay.
So, so dream college or dream branch?
Always a dream branch, because dream college will stay with you for 3 years. No one will ask you where did you do your PG from. No one will you yourself won't care about those 3 years after 30 years or 40 years of experience. All you will care about what you have to do from waking up in the morning to till the night. That will matter to you. It will stay with you for 40, 50 years. So choose those 50 years over 3 years. Any day, choose those 50 years over 3 years.
So now that we picked our branch, there is one thing. As UGs, we are not exposed to some branches much, like derma, radio, all these things. How do, how will an MBBS aspirant, PG aspirant decide should I go to radiology?
Easiest way I will tell is follow me, follow the Neurosurgery calling, and no, come here and see those people talking about their branches, their perspective. This is the easiest way. But even like we will try to do our best to bring about best consultant and best PGs for our branch. We will have some limitations that we can't bring many people, not many people at one time. So you can always go to those consultant who are practicing in your area or nearby area. You can go and visit them. You can ask about their daily life and put yourself into that condition. That for 50 years of consult, there is one 50 years of neurosurgeon working in your city. You want to be a neurosurgeon. You go to him. You ask them, sir, how do you live? How is your 24 hour? Can you describe to me? He will tell, this is my life. This is my 24 hours. You put yourself into it. at the age of 50, will you like that life? If you like that life, it's okay, it is meant for you. If you don't like that life, it is not meant for you. That's what I am trying to put by know your calling. I want to give you the feel of the branch, where the way you are going to live. That's what matters.
Sir, some students like yourself, sir. You are, as you said, you are from Gujarat, but I
Hmm.
know that you practice in Kerala. So it must have been a major cultural shock. How
Yeah,
does this come into play during residency?
it has been for me like starting few months were like hell. I don't know the language. I don't know if they are kidding about anything. They are all are laughing, and I will just see their face. This was the scariest moment for me. I couldn't laugh at all. I can't eat the food. Almost like I am pure veg. I am pure Jain, and I get 80% of food here is non-veg. I can't eat those food. I don't know the language. Even staying here, no friends. Okay. So talking to patients, I always need someone's help. So it was very, very, very difficult starting. But now I know the veg restaurants. I can order the food from there. I can cook my food. Now it's little bit very less because I don't have time. But when I get time, I cook for myself. I know the veg restaurant, so my food problem is solved. I talk to my friends in Hindi and English. Some very few people know Hindi here. Only English we can talk. That too only with doctors. Not many people know English also. So, but there are doctors who know English. There are few people, very few people who know Hindi. So I made friends. I made friends out of them. I go out with them. Okay, I enjoy that. So, language, I learned a lot in last 4.5 months. Now I can explain patient your surgery is needed. This. You have to. You don't take to take food after 10 p.m. and like those all those things I can explain. What is their condition? Why they are here for? What surgery? What prognosis they can expect? I can explain all these things in Malayalam. So anyway, your first year of life, first year of PG life will be very very hectic and very hard. So in that hardness, you can add one extra hardness of this cultural and language differences, and you can live with that. After 6 months or 1 year, all you will get is the benefits of perks of being into good college, good institute.
So to summarize it all, few points, with few common considerations while choosing colleges.
That will be mostly that individual based. But I will tell few points. If you are a person who don't like much changes, who are not open to changes, you should stay into your state. Okay. Then then if you are a person who is ready to explore things, you can go out of your state. Then for general branches like general medicine, general surgery, like those branches where specialty are very common and very almost available at every place, then you need to see what your specialty people, what the general people are doing in that college. Like if I tell about one general surgery hospital, where there is a gastro department is different, uro department is different, neuro is different, endocrine is different, even diabetic department is different. So all they are doing is hernia and appendix and hydrocele. General surgeon are doing only these three things. So all things are referred. Even if those things are referred, if those patients are admitted into your ward, and you take care of those patients every day, you are allowed to go and assist the neurosurgeon and gastrosurgeon frequently. Then you can choose that college. But if you are not allowed, every ward is different. Specialty wards are different. You don't get to see those patients at all. You don't get to see those patients in emergency also. Then there is no meaning of going into that big college, big name college. So that is one point. One other point by choosing. Then variety of patients. Like if you go into medicine and every patient with creatine in his eye, like you go into nephro ward, or see the nephro patient in general medicine ward, and you found out that there are 10 patients with high creatinine, all of them are of CKD, then that college is very bad. Why? Because if creatinine is high, they put it as CKD, means they didn't diagnose it properly. There is no way it is possible that all 10 patients are of CKD. Okay. Or okay, any diagnosis, like all patient cannot be of COPD, all patient cannot be like only of common disease. So if you are seeing only and only common disease diagnosed, then you should differ from that branch, that college, not branch, sorry, that college, because that is not for you. So this type of variety of things, then toxic environment to certain extent. Like if your seniors are very much toxic, not allowing you to live properly, not allowing you to breathe properly, then I don't think that much hardness is enough. Hardness is good for your health and good for you. But if the toxicity, differentiate toxicity, what is so-called toxicity? So-called toxicity means work environment. If you go into neurosurgery, you will have very frequently 36 hours, 40 hours of duty. Very frequently. You won't be able to sleep for hours and hours, and all these things will happen. This does not mean toxicity. Toxicity means when without any reason your consultants are scolding you. Even your consultants scold you 10 times, but for your mistakes, for even your minor mistakes, they are scolding majorly. It's not a toxicity. They are just improving you. So don't take these things as a toxicity. Actual toxicity means without any reason, any fault, there's an only purpose of their consultants or seniors life is to make your life miserable. That's the only thing. It is toxicity. So avoid toxic colleges. If someone is physically beating you or something like that, it's not appropriate. Don't go there. And if you go there, just try to come out of it. Means not leave the branch, or no, not leave the college. Just find out the solutions. Talking to authorities and everything. Try to find out the solutions. But other point about seeing the college is the freedom you are getting, not the hands-on or not the things, but if someone is, if you're third year resident, he cannot decide whether to admit the patient or not. If he cannot decide whether to do the IND or simple basic procedures or not, whether to intubate the patient or not, you have to be dependent on your consultant. That means you are not going to, you are not, it's not easy for you to practice independently. So that is also one of the things. But that may be again, like after 3 years, you can go into other institute. If your knowledge is good, you can do those things. So mostly this college choosing is something like you can choose based on your parameters. It is not basic, very much like that grading like system that if some colleges rank 1, some is rank 2, rank 3, rank 4, rank 5. It is not like that. For me, rank 1 college maybe rank 10 for someone else. For someone else, that rank 10 college may be rank 1. So it's purely subjective thing.
Thank you so much, sir, for your insights on this.
Okay, thank you, and
And
best
thank
wishes
you
to
for,
everyone. And from my side, I want to make one request to you that we are not charging anything for this initiative. We are doing everything for for helping you. You all are spending this much time on this. By since the time I started this KYC thought came into my mind. I have not slept for 4 hours any day. So this much hard work I am putting. All I am asking in return is just make the purpose bigger. Okay. If I can reach out to students, if it is helpful, if it is not helpful, tell me. I will close it. Okay. I don't have any ego, but if it is helpful, then please at least share it and make us reach out to more number of people. Make it valuable. If I am putting this much effort, my only request is please make it valuable. Please put your effort, share with your friends, ask them to share with other friends, make a cycle, make a chain, and please make it valuable. Or make our efforts. Please value our efforts. That's what we are asking. We are not asking for any amount of money or any amount of time from anything from you. Okay. So best wishes everyone. Thank you so much for listening and coming to our channel. Best wishes.
Thank you, sir, for your efforts and time.